Welcome in, everybody, to another edition of Doctor On Demand. I'm Andrew Salciunas with 97.5 The Fanatic, and today I'm joined by Dr. Tabaza, who, listen, this is incredible what he does. He is an interventional cardiologist and vascular specialist with Virtua Health. He does tremendous work at Virtua, and today we're going to be talking with him about vein and vascular health. And look, when you should be considering seeing a doctor, when things might become a problem, all kinds of stuff. We'll learn a lot today. So, Doc, let's start off with this. We're nearing the end of a long, hot summer, right? There was a couple of weeks where it was like 95 plus, felt like 105. It was ridiculous how hot it was. And we've had plenty of time to wonder about the state of our legs. So let's ask you, nice and simple, first things first, what are those blue, squiggly, bulging veins all about?
Sure. Thanks, Andrew, and thanks for having me. Those squiggly veins are called varicose veins, or spider veins, as some people know them. And those are caused by faulty valves that allow the flow of blood in the wrong direction and the pooling of the blood in the legs. Now, these can cause some embarrassment for some people, and they can be harmless. However, they can cause things like swelling and pain and discomfort. So if you have those, check with a specialist. These can be treated, and your doctor may prescribe you compression socks. They may ask you to elevate your legs and exercise to help promote circulation. There are also minor procedures that we can do in the office to get rid of them, such as radiofrequency ablation, laser, or sclerotherapy.
And what else could cause these to happen? Like, what could cause the leg swelling and pain? What could cause for these? Like you said, sometimes it could be embarrassing for people. What causes this?
Right. So other reasons for leg swelling that we worry about is clots, causing the swelling. And depending on where the clot forms, it can cause different symptoms. So a clot formed in the superficial veins closer to the surface is called or can cause superficial thrombophlebitis. And that is generally a benign condition that can be treated with pain medication and hot compression, or warm compression to be exact. Other areas that can, where a clot can form is the deep veins, and that's a bit more serious. Clots forming in the deep veins can cause things like pain, swelling, redness of the skin, or discoloration of the skin, and more prominent superficial veins. If you have these, I would say get checked immediately. The reason is these clots can dislodge. They can break and travel through your bloodstream and travel to your lungs, where they can cause a serious life-threatening condition called pulmonary embolism. And pulmonary embolism may require things like blood thinners. We also can do minimally invasive catheter-based procedures where we can go in, break some of these clots, and dissolve them or just remove them altogether.
Now, I feel like we never really talk about keeping our veins healthy, right? We always talk about, oh, how can I lose weight, or, how can I sleep better at night? But when it comes to our veins, how can we keep them healthy?
Great question. And I'm going to give you 8 things that you can do to keep your veins healthy. Number 1 is exercise. And when we're talking about exercise that can promote your circulation and improve flow, we're talking about simple things. Things like walking, things like a stationary bike or swimming are a great start. Number 2, maintain a healthy weight. Easier said than done. However, if you follow a lifestyle that is healthy with diet and exercise, you can do that. Number 3, elevate your legs. Gravity tries to pull down on the blood and keep it down in our legs. Elevating the legs 20 minutes or half an hour a day, keep them at the level of your heart or above, will help promote and reduce the swelling. The same token, try not to stand for a long period of time if you can, because that's going to maximize that gravity and worsen the swelling. Number 5, watch out what you eat as far as salt. Our body tries to maintain our inner mineral balance by keeping the salt to water ratio in the body at steady state. If you take too much salt, with that comes a lot of water, and the water is going to stay in the body, get retained, and cause swelling. So watch what you eat. Avoid things like canned foods and deli meats. Those can contain a lot of salt. Where are we now? Number 6, avoid anything tight. Tight clothing can cause impeding or can impede the blood flow and the drainage of and cause worsening swelling. Number 7, hydrate yourself. In general, as a rule, as an adult, you need to drink between 2 and 3 liters a day to start. So that's a good place to start. And finally, do not smoke. Smoking can damage those valves and cause worsening swelling and make your condition worse.
Now, what you guys are doing, this is incredible. If you have any of these symptoms that Dr. Tabaza talked about today, Virtua is doing something awesome. They have 2 free, and if it's free, it's me, screening days in October. We'll have the exact dates and locations on our website soon, so make sure you check that out. But please check it out and come see Dr. Tabaza and come see the Virtua team, because I think it's tremendous that you guys are going to do this. And what is a screening? It's just quickly looking over what's going on with your leg?
Yeah, you come talk to us. We'll do a quick ultrasound of your veins, make sure that everything is okay. And if there is anything that we need to work on and help you with, we'll just get you set up for it.
Well, thank you so much, Dr. Tabaza. I absolutely love having these conversations. You are all incredible doctors at Virtua. I really appreciate you taking the time with me. I learn more and more every single time. But I want to mention, if you heard anything that makes you think you might be at risk, make sure you check out their quiz. It's really cool. Virtua's online quiz. You go to the link virtua.org/vein quiz. Once again, that's virtua.org/vein quiz. So again, Dr. Tabaza, I really appreciate you taking the time today.
Appreciate you, and thank you for having me.